people are going to consume cannabis no matter what, it's in everyone's best interest to legalize cannabis, because consumption and market would be regulated. I must say that the issue here is to legalize the use of cannabis or its active ingredients in the cannabis plant for medicinal purposes. So to have a blanket legalization for consumption, for public consumption, may not be the way forward. It's going to be very difficult to regulate this, and probably not in our best interest to endorse the use of cannabis for recreational purposes. So there's another one here. My grandma had stage 4 lung cancer. She groaned in pain all the time, and I was desperate to find a way to effectively manage her pain. I almost ordered the cannabis oil, but it could put me behind bars. It was so frustrating. And I think I agree with Zandra that, her concerns are real, and she thought that cannabis oil could help her grandmother. And that's very much true, because it has been proven that cannabis products have been used for many decades, in fact. Unfortunately, we need to have a legal framework for that to be used in Malaysia, and we hope this will be a reality in the near future. My name is Dr. Andrew Mohanraj. I'm a consultant psychiatrist and president of the Malaysian Mental Health Association, and this is my expert opinion. Marijuana has been known for a very long time to be a very popular recreational drug. And there's a misconception that marijuana is harmless. It just makes you feel good, it gives you a sense of euphoria, and that's about it. But that's not true, because chronic use of marijuana can result in psychosis, and there is also some evidence to suggest that it can result in other psychological conditions like depression and anxiety. And we also know that when you take a very high dose of marijuana, almost immediately you can also have psychotic features like hallucinations and delusions. People do get addicted to marijuana, and chronic use of marijuana can see addiction in adults. And there are some studies that says 1 in 10 users of marijuana do get addicted to it. Now, if adolescents, young people start using marijuana regularly, then the figures go up. And as president of the Malaysian Mental Health Association, I am particularly concerned about the use of recreational marijuana in adolescents. Now, the adolescent mind is just maturing, developing until they reach the adult stage. So in this process, the use of any recreational drug like marijuana could result in a significant deterioration in their cognitive functions and making them less competitive and less productive as an adult. So these are things that needs to be taken into consideration, really, and probably that is the reason why the use of marijuana for recreational purposes are not legalized in many parts of the world. Well, I think we are on the right track to explore the possibility of legalizing the use of marijuana for medicinal purposes, but I think we should certainly explore also the kind of products that we are looking at, and for what particular medicinal indications, and how these products would be consumed, and how will it be made available. And just for the record, I must say the FDA until today has not approved of given blanket use of marijuana for medicinal purposes. What has been in the market are only products that are derived from the plant, I would think it is also good to identify which components of marijuana should be taken and used for medicinal purposes.
Okay, when we are talking about medical marijuana, we should actually be talking about the components of medical marijuana, the active ingredients in it. The two main components that have numerous medical benefits are THC and also CBD. THC is the component that can give you psychoactive effect, that people can say that you can become high, and also you may get addicted to it, but it doesn't mean that doesn't have any medical benefit. It has medical benefits. Another component is CBD. CBD is a hot topic now because it has been proven to not cause addiction, and it has almost zero potential for abuse. That is why most countries are pursuing CBD as one of the main components to be used as medical marijuana products. Okay, throughout the years, we have seen several countries approving or legalizing marijuana, whether medical or recreational. And when we go through their guidelines, the clinical guidelines, we can see that medical marijuana is actually being approved to be used as only as a third line or fourth line treatment. I mean, if the first line, if the conventional treatment is not effective, then only we can add on medical marijuana to the treatment. I mean, this means that it is not something that is very, very important. Of course, I agree, some patients really need it. But in terms of public health perspective, I think that it is not really something that is very, very important. But I think we should allow this to be explored more. I mean, if we keep over-regulating this area, we kind of limit the potential, lots of potential studies to be carried out, especially among public researchers. They need the leniency to carry out their researches. And I think with a lot more studies coming out, we can find a greater benefit and how best to use medical marijuana, especially CBD, in our Malaysian population.
I mean, there's potential for research here. And what is exciting here is that the plant, cannabis sativa itself, offers a great deal of potential for medicinal purposes. Unfortunately, the focus has been on the most common active ingredient, which is a psychoactive substance called THC, right? And I think there are about like 500 other cannabinoids, active substances in the plant. I think it is important to also explore the use of other components in this plant which may have medicinal properties without the dangers of that level of addiction, because it might work differently in the reward pathway and in the dopamine system. So you could have the best of both worlds, basically. You know, and that's what I'm hoping that research would reveal. But a great deal of work needs to be done in this area, and what's probably also pushing this is the fact that Malaysia does not want to be left behind in this development. There are many other countries in this world that have woken up to the need and the use of medicinal marijuana, and I think whatever we do must be based on evidence and what we see around us in other countries. So we are on the right track, but it's going to be the road ahead is not as smooth as we think. Well, at least as far as the benefits are concerned, I mean, we know in the United States they have many products. Some of them are available actually just over the counter, and it has been proven to be useful.